Good morning, everyone. Thank you for joining us today. I'm Paul Halverson, and it's my honor to serve as the professor and dean at the School of Public Health here at OHSU-PSU. This summer, we are really proud to celebrate the 10th anniversary of our School of Public Health. You may know our school is a result of the collaboration between the Oregon Health and Science University, Oregon's premier research and academic health center, and Portland State University, Oregon's most diverse urban public research university. Our founding vision remains rooted in a shared commitment to protect and improve the health of Oregonians across communities and across generations. Ranked in the top 25 of all schools of public health in the nation by U.S. News and World Report, we're really proud of the work of our faculty and our students and the collaboration and partnerships that we have here throughout our state. Today we're here to celebrate and to announce the formalization of a key partnership, and that partnership is rooted in our mutual understanding of public health's essence, is its partnership, its relationships, and its focus on protecting and improving the health of the public. As part of our ongoing growth, we're excited to announce a more formal academic health department designation with Multnomah County Health Department. This recognizes the long-standing productive relationship between our institutions and deepens the opportunities for learning and service. Much like teaching hospitals support clinical training, academic health departments provide a platform for public health learning and practice. We believe this new designation with Multnomah County represents a shared commitment to public health excellence, equity, and innovation. What this means for our students and our faculty, well, students benefit from mentorship by experienced public health professionals, incredible people at the Multnomah County Health Department who have devoted their life to the service to the public, focused on improving and protecting the health of the public. Our faculty gain valuable insights from on-the-ground work and local priorities. Again, it's that meshing together of what we research and what we teach and what we do in practice, and that's a huge gain for our students and our faculty. Our undergraduate, master's, and doctoral students will have expanded opportunities to apply their skills in real-world settings, and being right here in our home city of Portland. Our faculty will also be able to serve as resources, collaborators, and advisors in support of the health department's mission. And truly, this gives the opportunity for us to come together in a way that really benefits everyone. From the health department's perspective, it's also going to be important for us because we'll have access to be able to have the benefit of the expertise and the experience that the health department leaders bring in helping to teach our students, to help mentor, and to provide that expertise. This partnership enhances our collective ability to respond to public health challenges with a coordinated effort. It also enables joint research, policy development, and workforce training, directly benefiting the health of Multnomah County residents. And in general, also, I just want to sort of characterize our public health mission, and it's one that and you'll have a chance to meet here in just a second with Director Rachael Banks, who directs the Multnomah County Health Department, a key partner for me in our enterprise, focusing on this broader commitment. You know, in the last century, the U.S. added 30 years to the average life expectancy, and 25 of those years came as a direct result of public health advancements. At our school, we're committed to extending not just life expectancy, but the quality of life for all Oregonians. We continue to work closely with community organizations, neighborhood partners, and state agencies to improve health outcomes, but this partnership today with Multnomah County, as we're celebrating it, I think is the beginning of what could be really an incredible partnership that will advance public health in Multnomah County and in Oregon, and I think serves as a great model for the nation as we think about how to bring together practice, research, and the needs of the people in our community. So at this time, it's my pleasure to introduce my friend and colleague, Rachael Banks, who serves as the director of the Multnomah County Health Department. Rachael?
Good morning, everyone. It's a pleasure to be here with Dean Halverson, with you all to announce this groundbreaking partnership. And we are so excited at Multnomah County Health Department to be the first ever to partner in this formalized way as an academic health department with PSU, OHSU School of Public Health. As Paul said, you could think about this as like a teaching hospital. This partnership really with the health department is like that of a teaching hospital, where academic health departments are working with their governmental public health counterparts as we prepare and train students and faculty for the workforce. This collaboration is really a win-win for everyone. It has mutual benefits in teaching, in research, in preparing students for the real-life challenges that they're going to face as they come into the public health workforce. More of the benefits that we're excited about include professional development for our staff and interns and pathways for students coming in. It provides the health department with residents who, as they're in their training, will be working with each and every person, which is our mission. In the health department, we're the only department that is responsible for the health of every single person at every single stage of their life. And the benefits of working in a public health department and learning is that you get a range of different opportunities to really enhance that learning. I can say as a graduate of Portland State University graduate program that I know the education that folks are getting here is top-notch, and matching that with the opportunities that we can give students in applying that is just a win-win. It's also a key part of our workforce retention strategy. I don't think it's any secret that the public health workforce has been hit hard, that we're experiencing burnout and uncertainty in funding and other challenges that we're facing. So this is really an opportunity for us to enhance that workforce and to increase our retention, to improve morale. Ultimately leveraging the core faculty at both institutions to gain those health outcomes that we all seek, whether it's clean air, clean water, thriving communities to raise our children in, as well as increased life expectancy and addressing those things that are yanking down our life expectancy, whether that's overdoses or suicides or chronic diseases. So we are so excited for this pathway to for our staff to teach courses, to enhance the curriculum that's being taught here at this school, and ultimately to solidify this partnership. I'd say together we're building a more strong, more resilient, more thriving community for everyone in the city and ultimately in the state, for an improved infrastructure for health and healthcare. And this, for both institutions, really allows us to strengthen our ability to serve the city. As the school says, let knowledge serve the city, and ultimately the state. You know, in good times, this partnership would be a great idea, but in the times that we're in, this partnership is really a must. Thank you.
Thank you. We'll be happy to take any questions that you might have. I would just reiterate something that Rachael just said. This is not just a nice thing to do. This is really critical. It's critical for our students to get real life experience. We give them terrific theoretical underpinning. It's really important that they get good practice experience, and they'll do that in a way that will help the health department and also improve their skill base. And so that's really terrific. And our hope, in fact, it's more than our hope, our real expectation is that many of our students will find exciting careers in governmental public health right here in Multnomah County. And so this is what we hope to be a great model for us as we think about ways in which we advance together. Happy to answer any questions that you might have.
How long will it take to implement and get everything in place and up and running to where you want it to be?
Well, I think we're already starting. We have a number of our students that are beginning to have experiences at the health department, and our faculty are working with leaders at the health department currently. We're going to take it to the next level. We want to try to make sure that every one of our students get the opportunity to have an experience in a governmental health department, particularly here in Multnomah County. And we're just beginning our strategic planning process, and I'm so proud that Director Banks has been able to be with us as we're beginning our strategic planning. I think we can take this to an incredible level where we do see people that are practicing public health, leading public health from the county perspective in our classroom, helping to teach our students, for our students and our faculty to be at the health department, to actually be engaged in doing collaborative work. That's, I think, our goal. And that's going to take a little while, but we're working on it right now. And we want to try to take away and remove the barriers. The other thing that's really important is that frequently there are times when we're in an epidemic situation where the capacity of the health department may not equal the real demand for the circumstances. So a big foodborne outbreak or a disease outbreak of various kinds. Our hope would be to build capacity so that our students and faculty could add to the capacity of the health department to be able to help in times of emergency. And so that's another, I think, tangible way that we can see a benefit for the county.
I would say in addition to that, so what we've done now is we've formalized, we've inked this partnership with a memorandum of understanding. As Paul said, Dean Halverson said, we have students, we have residents that are working in the health department right now today. We have student interns, we have college to county interns that are there right now, and we just want to continue that partnership so that every single student has an opportunity to be stepping foot into the health department and joining with us on a variety of different efforts that really range from early childhood, working whether that's in a WIC clinic with families and nutrition, all the way to healthy aging efforts. So we're just going to continue to build and strengthen, including curriculum development, teaching, research, so on.
I think it's a great way in which we can see the extension of the commitment that PSU and OHSU has made to its community. It's not good enough to simply train highly qualified people to go out and do good things. It's really important that these institutions, these educational institutions, are part of the community, and we want to be part of the solution. I love the slogan essentially from PSU, let knowledge serve the city, and that's exactly, this agreement is a great example of what that may mean, and I hope that we can live that out every day.
You mentioned, and I apologize if you've covered this,
Yeah.
but you mentioned the potential for some of these newly minted public health workers to go out around the state. We know that counties all over Oregon really suffered during the pandemic with public health, people leaving public health. What kind of impact do you see on this, on areas outside Multnomah County from this program?
Well, I would say this is where we start, and I love Rachael's experience being both here in Multnomah County, but also having been at the Oregon Health Authority. And we have strong relationships with the OHA as well. Our hope is to work with all of the local health departments across the state, actually, to see if there might be opportunities for them to provide an opportunity for our students, for us to help those local health departments. We really do see our responsibility as the only school of public health accredited by the National Accrediting Council for Oregon. We have a strong statewide responsibility. We want our students to get out to the different parts of the state, but it's also really important that we take care of our home place as well. And it's so much, so convenient to be able to have our students have an experience in Multnomah County. So our hope, my hope, is that students will always get an experience in Multnomah County, and they will also get a chance to be out in our rural areas. I think taken together, it gives the students a good opportunity to see what public health is like throughout Oregon.
Yeah, and I would add to that some of the benefits, including being that training ground, but some of the things that we will be able to do are create certification and training programs that could be applicable in other parts of the state, in rural areas, whether that's through videos or other mechanisms. Right. And what we've seen here and what we're proud to be at Multnomah County Health Department is not only a local health department, but the services and the infrastructure that we've been able to implement benefit folks across the state, whether that's people who are coming into our clinics as they're enjoying the city, whether that's folks who are coming into our restaurant culture and enjoying the food that our environmental health inspectors are ensuring are safe, all of those things. So both for the people that are coming into the city, but also the training, the materials, the curriculum that could then be applicable throughout the state.
I think it's also great extending that analogy around a teaching hospital. A teaching health department, particularly in a large urban area like ours, has a great impact around surrounding counties, particularly smaller surrounding counties. And it's already the case, I think, that Multnomah County has served as a referral center, if you will, being able to provide expertise and support for surrounding counties and communities. That's a model, actually, that I think Multnomah is well suited to be an example for the rest of the country. We see these larger centers being the support for the smaller centers and neighboring communities. And I think that's always been part of your strategy, I think, is to be a support to our neighbors. And you do that so well. Thanks, Rachel, for what you do in that regard. Any other questions? Thank you so much for coming today. We really appreciate it. Rachel, I'll be here if you